Hello everyone, welcome to this channel. In my last video, I talked about liver anatomy. If you want to see the video, then click on the button and watch the video now. Today I'm going to talk about our last part of the hepatobiliary system, which is gallbladder, hepatic duct, and bile ducts. Okay. Now, first of all, I'm going to talk about gallbladder. As you can see in this photo, this is a green color pear-shaped organ, or you can say avocado-shaped organ. Anyway, so this organ presents in the inferior surface of the liver in the fossa of the gallbladder. Okay. Now, it is present in between the porta hepatis and the inferior border of the liver. That's it. In adult, it is almost 7 to 10 centimeter in length, and the widest part is almost 3 centimeter broad, and the capacity is almost 30 to 50 ml or milliliter. Okay. Now, this gallbladder has three parts. First of all, fundus, then body, and then neck. This fundus is present just near to the inferior border of the liver, and it's little bit protruded anteriorly so that it can touch the ninth costal cartilage, this side, ninth costal cartilage, and it touches the lateral border of the rectus abdominis muscle, right side. Okay. Now, this is related anteriorly with the anterior abdominal wall and posteriorly with the transverse colon. That's it. Now, the body part. Body is present in the fossa of the gallbladder of the inferior surface of the liver. Okay. Now, suppose this is the body, and body has upper surface, inferior surface. Now, the upper surface of the gallbladder is firmly attached with the inferior surface or the fossa of the gallbladder. Okay. Fossa of the gallbladder present in the inferior surface of the liver. Okay. Now, the inferior surface of the gallbladder is related with the transverse colon and first part of duodenum. That's it. And in the last, neck of the gallbladder, which is presents terminal point of the porta hepatis, and it continues as a cystic duct. Okay. So cystic duct is basically the continuation part of the gallbladder. Okay. Now, the neck is related with the first part of the duodenum inferiorly. Okay. Now, as I said, it is a continue as a cystic duct. Inside of the cystic duct, the lumen has mucus, and the mucus is formed especially spiral manner so that it can control inflow and outflow of the bile. Okay. I will tell this mechanism in physiology chapter, not here. Now we are moving into hepatic duct. Now, in my last video, I told you that from the right lobe of the liver, there is one right hepatic duct, and from the left lobe of liver, there is one left hepatic duct which comes out from the hilum, or which is known as porta hepatis. Suppose this is the entry or the hilum of the porta hepatis. When this porta hepatis, right and left, both hepatic duct comes outside, okay, almost 3 centimeter down to the porta hepatis, this right and left hepatic duct merges together and forms common hepatic duct. Okay. Now, this common hepatic duct goes downward, and it merges with the cystic duct of the gallbladder. Okay. Now, again, I am saying the cystic duct is basically the continuation part of the gallbladder. Now, common hepatic duct and cystic duct merges together and forms common bile duct. Okay. So now I am going to talk about bile duct, which is very, very important in your first year MBBS life. So the bile duct, as I said, it is a combination of the common hepatic duct and the cystic duct. So it is almost 8 centimeter in length, and the diameter of the lumen is almost 6 millimeter. Okay. Now, course of the bile duct. It is very important because this 8 centimeter of the bile duct, you have to remember that suppose this is the first part of the duodenum, the entire course has 4 segment or 4 station. First of all, supraduodenal part. After formation of the bile duct, it goes directly posteriorly to the first part of the duodenum. Okay. Now, the segment remains above to the first part of the duodenum, we call it supraduodenal part. The segment remains behind the first part of the duodenum, we call it retroduodenal part. The segment remains inferior to the first part of the duodenum, known as infraduodenal part, and then it enters into the second part of the duodenum. So when it goes inside of the second part of the duodenum, we call it intraduodenal part. Okay, so this is the fourth station of the course of the bile duct. Okay, supraduodenal part you're gonna find anteriorly liver, posteriorly portal vein and epiploic foramen, and to the left hepatic artery. Okay, now retroduodenal part, in anteriorly you're gonna find duodenum, simple, first part of the duodenum, and posteriorly inferior vena cava, and to the left you're gonna find gastroduodenal artery. Done. And infraduodenal part, it is related with the head of the pancreas, and posteriorly inferior vena cava. Done. And lastly our intraduodenal part. Okay, intraduodenal part is very interesting because in my earlier videos of pancreas I told you that pancreas has common pancreatic duct of Weyer's and accessory pancreatic duct of Santorini. Okay, anyway you can watch those videos and you can remember that. Now this common bile duct, after the retroduodenal part, it enters medially inside of the second part of the duodenum along with the common pancreatic duct of Weyer's. Okay, now when this two duct enters inside of the wall of the second part of the duodenum, both duct merges together and forms ampulla of Vater. Okay, or ampulla of Vater. Anyway, now this ampulla is constituted by lots of sphincters, and it opens into the major papilla of the duodenum, I mean the second part of the duodenum, and this major papilla is almost 8 to 10 centimeter away from the pylorus part of the stomach. In the blood supply, first of all you're going to get cystic artery, which supplies the gallbladder, cystic duct, right hepatic duct, left hepatic duct, common hepatic duct, and the upper half of the bile duct. Second of all, you're going to get some branches coming from posterior superior pancreaticoduodenal artery, which supplies the lower half of the common bile duct. Now in the venous drainage, the upper surface of the gallbladder gives few venules which ultimately drains into the hepatic vein. Done. Now inferior surface of the gallbladder, right and left hepatic duct, common hepatic duct, all this duct gives multiple branches of venules which ultimately enters into the portal vein, along with the entire bile duct gives multiple branches of venule, ultimately drains into the portal vein. Okay, that's it. Now in the nerve supply you have to remember that right hepatic duct, left hepatic duct, common hepatic duct, gallbladder, cystic duct, common bile duct, the entire system is supplied by the cystic plexus, which originates from the hepatic plexus, which originates from the celiac plexus. Okay, additionally it is also supplied by the right vagus nerve, right phrenic nerve. Okay, so the storage of bile and the concentration of bile, this too is the main function of the gallbladder. Okay, so this is the last video of the last system of our body. So all the systems I completed, and thank you for being patient with me. From our next video I'm going to talk about special videos about special topics of anatomy. Okay, so see you soon. Till then, bye.